This module will give an overview of the essentials in establishing a referral protocol and a diabetes screening program. Certain basic elements should be considered when developing a referral strategy for diabetes-related retinopathy. The current standards of care developed by the American Diabetes Association are reproduced on this slide. Use these standards to develop a screening program framework. In addition to recommending the initial and subsequent intervals of screening, including pregnancy, it also mentions the use of retinal photography screening as a screening tool. The ADA also recommends referral to ophthalmology for macular edema, severe non-proliferative retinopathy, and proliferative retinopathy. Lastly, two commonly used treatment options, laser photocoagulation and anti-VEGF injections, are listed. There are various grading protocols which differ primarily in specifics about retinopathy staging. The particular protocol is not as important as deciding which one will work best for your particular program and uniformly applying it to all individuals screened. Other considerations are, is the image quality gradable? Various issues listed may cause the retinal image to be partially or totally ungradable. What is the protocol for a partially or totally ungradable image? Should the person return for a reimage or be referred to an eye care specialist? How should partially gradable images be treated when retinopathy is present? When it is not present? What is the referral protocol for non-diabetes disorders? Depending on the acute or chronic nature of the condition, non-sight-threatening disorders may be delayed. The final decisions about protocol and when and how to refer diabetes-related retinopathy or other disorders will be a collaborative strategy developed by three factors: the organization, office, clinic, or hospital in charge of the screening program, the eye care specialist responsible for patient care, and the training and experience of the screener. The following are some important points to remember when establishing a screening program. First, is a screening program needed in your area? Do people with diabetes in your particular area have access to eye care? How many are being screened for diabetes-related retinopathy? Various resources, federal, state, and local, will help you in conducting a needs assessment. If you find a need, partner with the local resources in your community to advocate for the establishment of a screening program. Collaborate with individuals, work, community, and professional resources. Are there any state or federal resources that can be utilized? Finally, any program needs funding and sustainability. Identifying funding sources and planning for sustainability of your screening program is an important consideration. These institutions and organizations may be helpful to identifying funding resources. In summary, these are some takeaway points when considering the necessity of establishing a screening program for diabetes-related retinopathy. Only 50 to 60% of persons with diabetes currently have a comprehensive yearly exam, although 93% are aware of the recommendation. In the United Kingdom, estimates are that one missed attendance at a retinal screening appointment is associated with a threefold increase in needing laser photocoagulation in the future. In England and Wales, where screening is conducted, retinopathy and maculopathy are no longer the leading cause of certifiable blindness among working-age adults. In the United States, for persons with diabetes over the age of 40, the incidence of retinopathy and sight-threatening retinopathy is estimated to be 28.5% and 4.4% respectively. Diabetes-related retinopathy screening can provide needed services to persons with diabetes in underserved areas to better manage their eye care. These modules were developed to enhance education and clinical skills for those interested in providing diabetes-related retinopathy screening. Thank you.